Our group is doing our video presentation on HPV screening as a primary and secondary prevention to cervical cancer. The patient population we are focusing on is women between the ages of 30 and 65. Our screening guideline recommendations, according to the National Cancer Institute, states that in older women, HPV infections are more likely to represent persistent infections. That is, they are likely to progress to cervical cancer if not detected or treated. Time frame for the screening for women aged 30 to 65 is every 5 years with a combined HPV and PAP. The procedure is when a woman lies on a table. A healthcare professional inserts an instrument called a speculum into her vagina to widen it, so that the upper portion of the vagina and the cervix can be seen. This procedure allows the healthcare professional to take a sample of the cervical cells. HPV testing is used to look for the presence of DNA or RNA from high-risk HPV types in cervical cells. These tests can detect HPV infections before cell abnormalities are evident. So according to the CDC, by screening for HPV, we can reduce the risk of developing cervical cancer. A person can lower their risk of cervical cancer by getting routine screening if they are women aged 21 to 65 years old. And about 65% of vaginal cancers are linked to HPV. About 35% penile cancers are also linked to HPV. And about 95% of anal cancers are linked to HPV. About 21,300 HPV-associated cancers occur each year among females, and about 12,100 occur each year among males. Cervical cancer is the most common HPV-associated cancer among women, and oropharyngeal cancers are the most common among men. In the U.S., public health prevention of cervical cancer includes both secondary prevention through cervical cancer screening and primary prevention through HPV vaccination.
HPV information to help prevent cervical cancer.
What's HPV?
Okay, so the human papillomavirus is it's a virus, duh. So, but anyway, first let me introduce myself. I'm Kim. I'm a MECHAN student here at UCLA. And this is Jennifer. She's a clinical nurse leader and my instructor. So we're giving information about HPV. It's a virus that affects 79 million Americans. It's so common that like nearly all sexually active men and women get at least one type of HPV at some point in their life. Like 75% of people will have HPV at one point in their life. And so HPV can cause cervical cancer, and about 12,000 women in the U.S. get cervical cancer each year. It's the second most common cause of death from cancer in women worldwide. So there are two strains of HPV, because there are a whole lot of strains, like over 100 strains of HPV. So there are two strains, HPV 16 and 18, that are known to cause cervical cancer. And so it is said to have the HPV vaccine to try to prevent these strains from causing cervical cancer. But if you're over 30, then you need to get screening. So how old are you?
I'm 32 years old.
Okay, so Jennifer is going to talk to you a little bit more about the medical aspect of getting the HPV screening.
So, what was her name again? I'm sorry.
Alex, and this is my boyfriend, John.
Hi, Alex. You said you were over 30, right?
32.
So what we're trying to do is we're trying to address the misconceptions that many women over your age, 30 and above, have about HPV screening. Many of them, think that they don't need it, that it only involves women who have many partners, and that's not necessarily so. With 1 or 2 exposures, you can get HPV. So screening is extremely important for somebody in your age group because it's underutilized, and also it is important because have you ever had an HPV vaccine?
No.
Okay, perfect. So that's why screening is extremely important for somebody your age, because according to current research, the vaccine doesn't appear to alter the natural history of infections, and it is not 100% guaranteed against actually getting cervical cancer. So in the screening process is where we can actually detect the cancer. Do you know how screening is performed, an HPV screening?
No.
Basically, an HPV screening is just more, it's in a more advanced form of your traditional pap smear. And what we do is the HPV screening identifies high-grade cervical intraepithelial neoplastic cancer earlier than a traditional pap smear.
Excuse me?
So basically what she means is that it's going to detect abnormal cancer cells.
Right, and these results coupled with the higher sensitivity of HPV testing, in addition to screening, allows for more accurate results in terms of HPV detection and earlier or detection also of cervical cancer. So this is why consistent screening is so important for someone in your age group. So as nurses, it is our responsibility to incorporate the latest advances in primary prevention, which are vaccines, along with screening, which is secondary prevention, which is something that you would do to reduce the rate of cervical cancers.
And just for some more information, I'm going to go ahead and give you these pamphlets on HPV and cervical cancers and what you can do to make sure that you don't become one of those 12,000 people.
Thank you, ladies. How do you think I should get tested?
I think you should. And I'll go with
Yeah.
you. Okay, let's go.
Let's go.
We should be. Hello, I'm Juan, the nurse practitioner. You are?
Alex.
Alex,
This is
nice
my
to meet
boyfriend, John.
you. John, nice to meet you.
Juan.
So, what do we have here today?
I want to get screened for HPV.
Okay, have you been screened in the last 5 years?
I've never been screened.
You've never been screened. Okay, that's good to know. Before we begin, do you have any questions?
Yeah, what are the risks involved with this procedure?
Okay, it's pretty simple. The risks involved include pain, vaginal bleeding, discomfort. I want to show you something. What kind of phone do you have?
iPhone 5.
Smartphone?
My boyfriend got for me.
Nice, good boyfriend.
I definitely am.
All right, there's this app
Sorry.
that pretty much gathers all the recommendations from the U.S. Preventative Services Task Force, and it lists them all in this one app. It's pretty cool. So you can get more information from this app. It's totally free, downloadable to your phone. But like I said, vaginal bleeding, discomfort, pain. Other limitations include false negatives, which mean, it won't detect anything when something wrong is actually there. But, the benefits heavily outweigh the risks. So, receiving the PAP test combined with the HPV screening will drastically increase chances of detecting any abnormalities in your cervix. So, these abnormalities may indicate cervical cancer. So, you want to get checked. All right?
What about men? Do men get tested?
For men, the CDC says there's no screening for men, so the best I could do is inspect your penis for genital warts. And that's the only form we would know if you have it or not, unfortunately.
I guess I would have to schedule another appointment.
Yeah. Call me.
I'll call you.
All right. Anything before we begin?
No?
Good. Let's do this.
Our case scenario is on a 32-year-old female who is a PhD student originally from Panama. We based our case scenario on the trans theoretical model because as she and her boyfriend were walking through the halls, they decided to receive some information on HPV screening, which is considered to be the pre-contemplative phase of the trans theoretical model. After she spoke with the nurses, she then went into the contemplation phase. She then made an appointment with an NP to explore the pros and cons of HPV screening, which is considered to be the determination phase. After finally speaking with a nurse practitioner, she then decided to go through with the screening process and went into the action phase. Our client consistently received her HPV and PAP tests every 5 years, indicating the transition into the maintenance stage and successfully demonstrating the impact of secondary prevention and nursing education.
I look and stare so deep in your eyes. I touch on you more and more every time. When you leave, I'm begging you not to go. Call your name 2, 3 times in a row. Such a funny thing for me to try to explain. How I'm feeling, my pride is the one to blame. Cause I know I don't understand just how your love is doing, no one else cares.